In today's fast-paced world where stress and anxiety are on the rise, a decent night's sleep is a luxury for many people. Something Faith and myself struggle to get because, somebody has to be here at 5 o'clock in the morning, no? Well, insomnia, which affects millions worldwide, is characterized by difficulty falling asleep, staying asleep, or feeling restored after sleep. To talk about it further, I'm joined now by Restonic Sleep Expert, Dr. Alison Bentley. A very good morning to you, Dr. Bentley. Thank you so much for your time. So this is something that I've come to find people really confuse here. You know, people think that just because, you forgot that you would have maybe had a couple too many cups of coffee, maybe a couple too many cans of energy drinks, and now you are sleeping, you're still awake beyond a certain hour where you usually aren't, and now you then throw the word insomnia in there, where in fact, you do actually get regular sleep at about 10 o'clock at night, which is your normal time. So what exactly is insomnia and how does it affect one's health? Dr. Alison Bentley, looks like you are muted there. We can see you talking, but you seem muted at the moment.
Muted. I'm not muted. So have we got it?
Yeah, we've got you now, yes.
Okay, thank you. I wasn't muted, so there's something on the other side. So yes, insomnia, it seems to be this kind of scary word that people go, oh, you have insomnia, like it's a big thing. Well, as you say, people have insomnia for one night. They have it for a couple of nights during exams, for example, or any minor stress that you might have during your work life. But insomnia can also mean a much longer problem with sleeping that can go on for decades sometimes. So insomnia really just means that you are unable to get the sleep that you need. And therefore, there's a deficit during the day, so that you know during the day that you're not functioning well. And usually it's not sleepiness. So it's usually what we call the executive functions that go first: concentrating, focus, having attention deficit, not the disorder, but an attention deficit, fatigue, and just things not going well during the day. And that can occur then every day because every night you're unable to get the sleep that you need. So insomnia can be acute, like just for a couple of days, and it can go on for years and years and years.
What are the different types of insomnia, Doc?
Oh, so many causes. This is why it gets a bit tricky because a lot of causes. So lots of medical disorders, for example. So if you have chronic pain, so rheumatoid arthritis, for example, often wake up in pain, find it difficult to go back to sleep because of the pain. And then there are a whole bunch of medications that can cause you not to sleep. So I'm sure people who have been on steroids for asthma, for example, might find that those interfere with their sleep. We like to think of alcohol as a drug as well, because that can interfere with your sleep. Things like drugs you can take for cholesterol can interfere with your sleep. And I say can because they don't automatically do that. It's just in some people. Then there are things like restless leg syndrome. So a feeling where before you go to bed, when you're lying in bed, that your legs are uncomfortable, that you have to move them. That can interfere with your sleep. Obstructive sleep apnea, so snorers and people who appear to stop breathing or hold their breath during the night, that can cause insomnia. Things like depression, anxiety, any psychiatric kind of cause can cause insomnia. And then really, honestly, the most common cause is once people have had it for a while, is this anxiety about falling asleep. So people become anxious about their sleep. Then they go to bed much earlier to try to get more sleep. Lie in bed for hours and hours and hours trying to get sleep. And all of those, the anxiety, the lying in bed for long times, and the extension of your sleep, so much longer than you would normally sleep, all of those are actually keeping the insomnia going at a very behavioral kind of psychological level.
I'm going to make this personal. Over the years, I've come to find that I function on 5 hours of sleep at the very most usually. So if I then maybe try and sleep a little later so I can wake up at normal hours. Whereas sometimes I find that I'll sleep at 11 o'clock and I'll be up by 3. So I never like to diagnose myself and say, ooh, I suffer from insomnia. But would that be something that could be a sign of insomnia?
Well, the critical question is, how do you function during the day? Because if you get 5 hours of sleep and you function really well during the day, don't feel fatigued, it doesn't, that kind of level of concentration and memory kind of problems don't interfere with your workday, then no, you don't have insomnia. What we would call you is a naturally short sleeper. And I think it deals with this issue that 7 to 8 hours is normal, and somehow everybody has to kind of pin themselves into 7 to 8 hours and do everything you can to get that number. And look, everybody's different, and the same thing happens with sleep as well. When you get a blood test, they don't say you have to be 5.5, otherwise you're abnormal. They're going to go, here's the range in which we find normal people. And the same thing with sleep. There's a range, and the range is often between 4 and 9 hours. The critical thing always is, how do you feel during the day? So if you function well on 5 to 6 hours, that may be completely normal. And you often find that other members of your family are also short sleepers. That's very familial, but not abnormal. Does that make sense? It's variant. The average is 7 to 8 hours, not the normal. It's a different kind of concept.
And I think that has been one of the worries for a lot of people like myself, because there are millions of us who do function on 4 or 5 hours of sleep, and then you think that, oh no, but that's not normal. But Dr. Alison Bentley, thank you so much. We'll leave it there, and I would imagine that people that are awake, insomniacs, or people that maybe think that they're insomniacs would have been watching this and getting just a couple of very important tips. Thank you so much for joining us this morning. That was Restonic Sleep Expert, Dr. Alison Bentley.